Good morning. This is Dr. Kyle Lopez with patient Miss Mary Fields that came in for us to see us for knee pain, correct?
Correct.
And how long had your knee been hurting before you came to see us?
2 to 3 years.
2 to 3 years. And what type of treatment had you had before coming in?
Just cortisone shots, and they told me that I needed total knee replacement.
Total knee replacement. And you wanted to do everything you could to avoid that?
Yes, I don't want surgery.
Don't want surgery. So we designed a treatment plan specifically for you. So since coming in, how much 0 to 100%, what percent change have you seen?
98.
So,
I'm doing great.
So you're 98% better, right?
Yes.
So even bone on bones, what you were told, and need a total knee replacement, and how old are you?
70.
70. So when people are told that, sometimes they don't think they have any options. So what would you tell those people that think that there's no other option?
They do have options.
Okay, well, I certainly appreciate you coming in, and certainly super happy with your results so far, and looking forward to even more good things for you.
Okay, thank you.